part 2 of canine impaction, and in this video we will talk about the differentiation between developmental normal and ectopic or impacted permanent maxillary canine. So these are the following words we will use for differentiation. Number one is palpation. So in developmentally normal canine, the canine is palpated buccally, but in ectopic or impacted canine, it is not palpable buccally, but it is palpable palatally or in high in the buccal sulcus. Okay, so the another point which is a differentiating point is deciduous canine. In developmental normal canine, the deciduous canine is mobile, so it has mobility. Okay, but in ectopic and impacted canine, there is absence of mobility, and it is around the age 11 to 13, which is the erupting normal erupting age of canine. The third point we will discuss is permanent lateral incisor. So in developmental normal canine, the lateral incisor is tipped distally, may be tipped distally, okay, but in ectopic and impacted, the lateral incisor is distal tipping, there will be discoloration or rotation. So, point of view, but it is also for diagnosis and treatment planning of the teeth, okay. So in developmental tooth, the word there is vertical resorption of the canine root, okay, but in impacted or ectopic teeth, there is no vertical resorption and there is no resorption of the deciduous canine root. And in normally developmental tooth, the permanent maxillary canine is crown, positioned between maxillary lateral incisor and first premolar, while in impacted or ectopic teeth, the canine crown is overlapping adjacent incisor roots and resulting in resorption of the adjacent incisor roots. Okay, so the magnification of permanent maxillary canine crown on a panoramic radiograph you can see, and the parallax confirming buccal or palatal ectopic impaction. The other the other differentiating point, and it is also very important, is developmental age. The normal erupting age of death, that is permanent maxillary canine, is between 11 to 13 years of age. Unerupted at age of 16, then the tooth will be impacted or ectopic teeth. Now the most common impacted teeth, which are maxillary and mandibular third molars. You can see in the panoramic radiograph, red arrow is demonstrating the third molars, maxillary, mandibular both. And the second most common impacted tooth is maxillary canine. The picture below you can see the maxillary canine, which is buccally position, okay. And the third most common impacted tooth are mandibular premolars. Just look at the picture, the circle one, they are demonstrating the mandibular premolars. And the fourth most common impacted tooth is mandibular canine. So the picture below you can see the red arrow which is showing the mandibular canine. So now the next we will talk about is ratio. So this is about maxillary impaction, okay. So the maxillary impaction occur more commonly in females than males in the ratio of 2:1. Risk factors that occur in the development of or risk factors in the development of ectopic permanent maxillary canines, and these are as follows. Number one is pack shaped lateral maxillary lateral incisor. The other one is developmentally absent permanent maxillary lateral incisors, or narrow maxillary arch, or early loss of maxillary canine, or the failure of resorption of deciduous maxillary canine. The other one is class 2 division malocclusion, oral collapse involving alveolus, dilaceration of permanent canine root, previous dental alveolar trauma, canine eruption, for example, supernumerary teeth, apical granuloma, or other pathology. And the last one is deviated adjacent premolar roots. So these are all the factors we have talked about till now. Please share, follow, and subscribe for more videos like this.